I'd like to invite ANAHI and her panel for our next session this afternoon, which is discussing the area of telehealth, consumer demand in healthcare, and the need to adjust delivery models to meet the needs of our changing consumers. And I think this is very topical in today's healthcare, as we heard from some of the earlier speakers talk about the the change in delivery from a doctor's office-centered delivery model to one of telehealth, telepresence, and remote access. ANAHI is the CISO of Christiana Care in Delaware, and I've had the honor of presenting with her at many events in the past. Thank you again, ANAHI. It's great to see you. Also joining her is Mark Eggleston, the VP and CISO of Partner Health Plans, based out of Philly. Great to have you again, Mark. And finally, last but not least, Mitch Parker, the CISO of Indiana University Health. And Mitch will be going on to present his expert session straight after this event. I'm not seeing Mitch yet on the panelists. Did we? Oh, there we go, Mitch. Thank you for joining us. ANAHI, to you have the microphone and the mouse. What more do you need?
That's all the power I need. Well, thank you for that introduction. Just to reiterate what Richard just noted, ANAHI Santiago, I am the Chief Information Security Officer at Christiana Care, which is the largest healthcare system in the state of Delaware, also serving the neighboring states. In terms of size, we're probably 24th in admissions, largest in the country. I've been there for about 5 years. Prior to that, I spent 10.5 years at Einstein Healthcare Network in Philadelphia as the Information Security and Privacy Officer for the organization. It is my pleasure to lead this panel, and I will let Mark and Mitch introduce themselves. So Mark, why don't you let us know a little bit about you and your organization, and then we'll hand it over to Mitch.
Sure. Mark Eggleston, I'm the CISO and privacy official over at Health Partners Plans. We are a Philadelphia-based regional HMO serving Medicare, Medicaid, and children's health insurance recipients in Philadelphia, and recently just got the statewide contract. So we should be growing exponentially here in the next year. Really eager about that. So in my role, I've been able to handle a lot of the COVID work from home situation here over the last several months, and of course also ensuring our privacy and security controls remain in place as they always have been in the old normal. So happy to talk about lots of different questions here. Mitch?
So good afternoon, everyone. I'm Mitch Parker. I am the CISO at Indiana University Health in Indianapolis, Indiana, the largest health system in the state of Indiana with 16 hospitals and hundreds of clinics. And before I was here, been here about 4 years. I was the CISO at Temple Health in Philadelphia for about 8.5 years, and before that was a defense contractor. So very happy to be here. Thank you all very much for having me.
Well, Mitch, it's great to welcome you back into our Philadelphia family, if only for a short period. So let's get right into it. I think there's been a lot of talk about consumerism and telehealth, especially in the wake of COVID and most of us having to work from home. So I'd like your thoughts on how have your organizations adopted technology, both to deliver virtual care as well as to just meet the overall consumer demand, which has clearly changed in the last few months. Mitch?
So I can tell you a major challenge we had is we had to ramp up very, very quickly. And it meant not adopting just one technology, but several, because with an organization of our size, you had multiple needs, and therefore instead of just having Amwell, you would have to bring in a couple other technologies. And also you have to think about what happens if and when something fails. So we had an aggressive move to telemedicine very, very quickly. And we like to say we did 5 years worth of work in about a week.
Wow. And Mark, what are your thoughts? How have you been using technology, either prior to COVID or in the last few months, to enable your business and your consumers?
Yeah, from a health plan perspective, a lot of our technology was more internal facing. We're a Microsoft shop, so of course Teams and Skype for Business are heavy in play, and we allow other services as well, like the platform we're using today. So, it was making sure that people knew about those type of platforms, and also making sure that people knew how to make that leap to digital for people that maybe don't embrace digital. And I guess a good example that comes to mind is when people join a physical meeting room. If they're not supposed to be there or they're a stranger, it's pretty easy to quickly identify them. On the digital platforms, it's a little bit harder. You're going to see somebody come in as anonymous or guest, or you'll see a phone number come in. So I wrote a blog actually empowering our workforce to say, hey, look, if you're holding a meeting or you're even in a meeting as a participant and you see somebody there who should not be there, or you don't know who they are, it's your job to challenge them verbally and then boot them if they don't give you an appropriate response. So it's given a little bit of guidance like that to help people make that leap. The other piece we did is out on our website, which is still out there today, public facing, is we have a provider page. So we wanted to make sure that our provider networks, our hospitals, knew all about the telehealth options and waivers that were being issued by federal and state agencies, and that they were, clearly moving forward with telehealth where they could. We've still remained physically closed, but 100% of our workforce has been working remotely since March. So I think we're turning the corner and embracing this. In fact, we don't see going back to the way things were. We see ourselves going back to a new normal in October. So I'm part of the group that's also looking forward to implement a pilot and also making sure that we are embracing this across many different things, not just a pilot and all the physical precautions, but also empowering our management teams on how to lead people that are remotely. And then, of course, making sure that everybody's embracing all the digital technology that we have to get better at, because there is no new normal. I mean, if you look at the studies now, people that are working in a physical workspace, it doesn't sound fun. Complete this app for your health, get your temperature scanned every day, wear a mask except when you're eating. And if you go to a conference room, you're only going to be at half capacity anyway. So I think most of us are really enjoying the work from home situation if we're lucky enough to be doing so.
Yeah, you bring up some really good points, especially in terms of, the adoption of all this new technology that our employees and our consumers have not traditionally been used to using. And not only the usability aspects of that, but also the fact that there are security components and security concerns with a lot of this technology. I know for us, the push in the last few months to adopt technology to enable virtual care and enable apps that do, that our caregivers use to check in before work to determine are they red, yellow, green, so on and so forth, has been a really big challenge in terms of ensuring that as partners we're enabling the business at the rate of speed that is required at this point in time, while still maintaining some level of security. So how have you partnered with your organizations to evaluate these tool sets from a security perspective? Mitch, what process have you engaged in to ensure that you're not introducing additional risks with these new technologies?
I will tell you that we have a third-party risk team in my organization, and I've actually been directly engaged with my team and with the vendors to make sure that we have reasonable and appropriate security protection. Like, for example, we were looking at a solution for our remote patient monitoring. I got on the phone with the CEO of the company, had a very good conversation with him about how this technology is going to be used and how they were securing it. And so we've taken the approach of being very detailed in how we look at this information, how we look at these new systems and how they integrate. More importantly, what can we do now to get the system secured when we put it in, and what can we put off to get this operational? Because again, you take a look, for example, our organization has a very large pathology lab that does testing for a very large percentage of our population, not just my employer. So you have to take that into consideration and weigh the risk of, do you delay this or do you get this in because there's a greater need? So we go towards greater need. What can we do now? What can we put off? And what can we get the vendor to do at the factory above and beyond so that we can get something delivered, get it in, get it operational, and hit timelines. And the other thing that we've done is we actually had a predefined catalog of solutions. So say, for example, when they did the relaxation, the telehealth rules, the big challenge that we had was, okay, we have all these different solutions out there. Turns out we actually had a catalog of solutions we could use under what context with certifications. So for example, Microsoft Teams is HITRUST certified. At least it is under the terms of the letter we got from Microsoft. We handed that out to our customers and said, here, we can guarantee if you use a solution, you have a reasonable and appropriate degree of security. And so that meant that we were able to deploy that solution very quickly out to a number of people, both as a primary and a backup. But again, it's about taking a look at what's coming in, talking to your contracting team, talking to supply chain, and being very pragmatic in your approach of how you're going to deploy something out to your workforce.
Mark, any additional thoughts?
No, I mean, we're using technology such as a CASB, which helps us control a lot of the flow up to cloud apps. And so with that, there's a cloud scoring. So we're really starting to peel back the onion there and look at the scoring to confirm its validity and work with a small subset of our more risky vendors to see if we can work with them to improve their score. But, you know, with that type of technology in place, I feel a little bit more at least aware to the threat, and then we can go down and help chisel away that amount of threat or amount of risk. But we're on the right path.
And so going back to my reference to the pace that we've all been asked to function, what challenges have you found? Have your teams been able to keep pace with the demands, not just of your employees, but also your customers who are now expecting to still get care, or expecting to communicate with a health plan while doing it remotely?
I mean, I think we've settled into a new normal here, but I will say the first 2.5 months of this were darn challenging. I know, ANAHI, we've talked about this offline as well. It's not unusual for most CISOs' calendars to be quite booked with meetings, right? But a lot of us, especially in my case as well, we have the role not just of enterprise security, but enterprise business continuity and resiliency. So those first couple of months were pretty hairy. It was a lot of meetings for any old reason during the day, and then catch up for several hours after dinner to make sure you caught up with the streams, and making sure really embracing the culture of our company, which is no questions too beneath us. We want to make sure everybody's got everything what they need. So, we started a COVID-19 webpage and just inventoried all the decisions that our various business continuity teams made. In fact, I just updated it last night because we allowed people to come back in to retrieve personal belongings. And now we're closing that down again because our building, like I said earlier, still remains closed. So it's making sure that you can adapt your culture to still being friendly and accommodating to your workforce while also letting know that they care. And to your question of, what kind of things have we adjusted to? A lot of times I'm putting on my psych hat and just starting with each team member, hey, how are you doing today? Where are you at? Because me, and I know we've had these conversations before too, with 3 young children or 3 older children, they're all teenagers now as of yesterday, but they're very fun to be around and they're very independent. Mitch, on the other hand, who has younger children, he might have a slightly different perspective in how this whole work from home thing is going. So, it's those type of things we have to keep in mind when you're working with your customers, working with your directs and your workforce. Everybody's situation is a little bit different here.
Okay, Mitch. Yeah, I mean, you're definitely juggling an awful lot. Have you and your teams been able to still maintain the pace?
We've had to increase our pace. I mean, there's no other way to put it, is that people want things very, very quickly. And so my schedule actually got more full because of the fact that I am no longer commuting. So that gives me back an additional 90 minutes a day, which has been promptly taken up by a lot of meetings, a lot of reviews, a lot of conference calls. And so we're trying to balance everything we've done for COVID, all the new work that we've had to do, plus all the additional work of people trying to play catch up as things initially subsided here in the state of Indiana. We had work pick right back up, and plus this happened right in the middle of our new CIO starting out. So It's called Welcome Back to Indiana, Tim. Here's a pandemic to deal with in addition to trying to rebuild your leadership team. So it's been difficult. Plus you put on the fact that I've got 2 5-year-olds at home and a wife in grad school, and there's been a lot of sleepless nights. And so I'll be honest, there's a lot of stress out there. And what I've had to do also is check with my team as well, because there's a lot of people in my team that also have younger children. Make sure they're okay. Make sure team members that may have relatives in the hospital are okay, or elderly relatives, make sure they're okay. And make sure that you have more team meetings than normal and that you're talking to everybody. And that's what we've had to do. And in addition, I've also reached out to people I know in the community who may not be in a good situation as well. It's about being a good community member, about being a good team member, and everyone's got a lot of additional work these days. You just have to make sure that you're there for them.
Yeah, you know what, Mitch, we talk so much about the technology that we're deploying and employing, and not as much about the people that we rely on to lead these efforts. And yeah, to your point, you know, keeping checks on the team members has been so important. We have 3 huddles a week just at 4 o'clock, touch points. Hey, how you doing? What do you need? What's going on? Because the pace that we're moving in, it's just, you know, we can't wait for that one weekly team meeting that we used to rely on. We also can't just roll over to the next cubicle to ask the question or check in on somebody. So the people aspects of this have been truly important. But going back to the technology, you know, Christiana, we had already begun to deploy virtual health. We had primary care practices that were fully virtual. We had platforms that that we had contracted with for virtual health and for other means of remote care. What our challenge was scaling out in a very, very short period of time. So, Mitch, I recall you saying you had like 7 or 8 telehealth solutions. So can you speak a little bit about how your organization was able to scale out, what issues you may have encountered, what other organizations that maybe are lagging behind can learn from?
So I'll tell you exactly what happened, which is our primary platform did not scale for the first week, and our other platform we're using as a main teleconferencing platform also didn't scale for the first week. So we had to have multiple systems in place because we had scaling issues with the first 2. And what ends up happening is when you do something like that, people get in the workflow. They have a way of doing things, and you're not going to easily extricate them from those systems. So we had at least 7 different systems we were using across the system because, again, this place is huge. So we provided guidance on how to securely use them, what was approved, what wasn't approved, and why. And instead of having one group we had to talk to 6 or 7 about why you made the security decisions that we did. But yes, the issue we had was that a couple of the systems had seen unprecedented increases in traffic, and we had to compensate for that. And sadly, what happened is in the case of when people do that, they will stick with the solution they know works. A lot of superstition out there, and that's what a lot of people did.
So Mark, talk about approved and unapproved devices and platforms. CMS sure didn't do us a favor when they came out with their memos related to COVID-19 and created a lot of confusion around even whether there had been changes to HIPAA or whether this is something temporary. So how did your organization respond, and how did your employees respond to these memos and to this new information that was coming out to the general public, which generally it's us disseminating this information out to our employee base? You're on mute.
Thank you. I like the approach that each of us have taken in our, you know, when we post on LinkedIn and such, when you kind of distill information, right? So it's normal for OCR, HHS to release a plethora of memos in any calamity. They did this with Hurricane Sandy. They've done this with lots of different issues. But I have not seen as many as I had right now with COVID. By my count, there was 8 announcements and 3 enforcement discretions. Those enforcement discretions really were just that. They're saying, hey, we're going to turn the other cheek if you have a boo-boo. The OCR, they did not really change HIPAA much, or they didn't change HIPAA at all for us, or probably most any other HMO. There was some changes with testing sites, showing which platforms were acceptable, but even then they're also quick to say, hey, we're not saying this isn't a recommendation, we're saying these platforms are okay, like Zoom. And Zoom has been beat up a lot recently here too, and then kind of made some nice recoveries. So, I'm always passionate about security, so I'm happy to talk in depth about the Zoom piece. And to your question, ANAHI, we had our privacy manager create a blog and say, hey, here's all the information released from the government. Here's what take it down a notch. Here's what this means for health partners plans. And it wasn't really much of a big change there. So I didn't see a whole lot of change from the enforcement discretions and the other OCR announcements. I think a covered entity, whether you're an HMO or provider, would still be very wise to talk to your privacy and security official and make sure that the platforms and the things that you're doing are indeed, at least meeting your due diligence, because the court of public opinion is still much different than OCR giving you discretion. And I would not want to be caught up with that. Even the discretion piece, if you look at what they're saying is not good, any security manager worth their salt should not be considering deploying Facebook Live, Twitch, or TikTok, especially with the recent news of how it's coming in with iOS devices and whatnot. So yeah, if you're a covered entity and you're using any of those 3 platforms, I think I'd question a lot more than just that choice.
Yeah, I will say in my organization, I've been challenged. Our caregivers have pointed to CMS's announcement, and then I've actually had to go as far as to explain the difference between a telephone call, a cell phone call, and a video call, because our end users think they all carry the same risk, and challenged what the difference was. So I've become quite the educator on communication technology as of late.
Yeah.
So in terms of technology consumerism, do you believe that COVID was the catalyst for this mass adoption? Do you believe that our consumers, our patients, our members were the ones to drive this fast-paced change? You're both in different healthcare industries, so I'm really curious about both of your perspectives. So Mitch, let's start with you, and then Mark, share yours as well, please.
So I believe that COVID was a major catalyst for what we have seen with telemedicine, because we've had telemedicine for years. Most organizations have had it for various bespoke capacities, but its first use en masse that I've seen into this scale was for COVID. And it was further evidenced by the fact that a large amount of these companies were not able to keep up with the demand. So we believe that, yes, this was a catalyst for advanced telehealth. And I will also tell you that I don't think the genie's going back in a bottle. I think we're going to see more of this because it's too convenient for our patients.
Yeah, I agree with Mitch. I've often heard that really when you're talking about sweeping change that we're all witness to right now can happen in 1 of 3 ways: either regulation, innovation, or consumerization, right? And I think right now we can honestly say that all 3 of those are on fire right now. Yes, there is regulation, CMS interoperability rules, which is basically HIPAA v2. Says you had better start sharing your PHI with consumers or on demand, right? So that box is checked. Innovation, the platform we choose to use right now, it just works. There's no glitchiness that I've seen so far. Hopefully we're all coming across crystal clear. Other technologies aren't that great. I know this platform has just been very solid to use from a customer experience piece. And the consumerization, the last point, I would rather not take time off and work from home to go see my doctor for a checkup or something I can do like we're doing right now. So why would you want to roll that back? You know, that genie is out of the bottle and there's no way that's coming back. So I think all three of those things are testament to why we're on such a powerful path right now with doing this. And there's more regulations that are coming out too. Besides the CMS interoperability rule, I've heard that Drug Enforcement Agency has joined SAMHSA for substance abuse to allow audio-only prescribing of opioid use disorder treatments, and also allow maintenance drugs from just a telehealth exam. That would have been unheard of even a year ago. There's another rule coming out called TREATS, which allows, you know, it's just proposed at this point, but it's going to help more and more people with other substance abuse orders and use telehealth. So there's a lot of things that are coming around the corner and are in place right now that make me think this is here to stay.
Yeah, one of the things that we haven't really talked about was in terms of consumerism, are all the consumer devices that our patients and our members might want to connect to our systems in order to marry up clinical records, insurance records with personal data that might be of value across the continuum of care, but also the consumer devices that we may actually send to people's home with them so that they can help us manage their care. Any thoughts around the future where you see this a year from now, 3 years from now, and how the unique risk landscape is going to change based on all of these consumer devices? Mitch?
So I can start off with this one and tell you the consumer devices are coming. Apple was one of the first with the Apple Watch, and they're certainly not going to be the last. And I think that we're going to have a significant amount of these devices being part of the care continuum because people do want control over their information. They want to use it, and they're going to utilize interoperability to do so. So it's in our best interest to facilitate better ways they can utilize consumer devices in their own individual care processes. And again, you're not always going to have the opportunity to give people hospital issued devices. So we're going to see a lot more consumer devices, and this has accelerated it because no one's going to have the budget to do everything they'd like to do in the hospital walls outside of them. We're going to see a lot more of a shift to the outside, and to do so, we're going to need consumer devices to help fill those gaps.
Yeah, I would agree. The CMS interoperability rule exists for that reason. If somebody comes to you and says, I want my data on my Fitbit, I want it on my Apple Records app, it's your obligation to give that to them. It's their call. So the risk reward analysis, I think, is falling more on the consumer, the patients, the members, if you will. And I think that's pretty much a good thing. Now, it does expose a gap because obviously patients, consumers are not covered entities. So how do you do that? Nor are these app developers. But I do foresee that there's going to be some more consumer healthcare laws that come out to hopefully augment and not replace HIPAA. At least that would be my expectation or hope.
We are at time. I don't see any questions in the Q&A. Just 30-second parting thoughts before we give it back to Richard. Mark, you have the mic, so you might as well go.
Sure. So in brief, and before we give it back, hold on to your seats, folks. I think we're just at the beginning of a lot of rapid change in healthcare, and I think it's our job, healthcare professionals, IT professionals, privacy advocates, to make sure that we work together to remove the barriers and improve the vast understandings that are out there now preventing this from happening, say, 10 years ago. So look forward to working with anybody who's willing to lead the charge with me.
Mitch?
So I can tell you that what's happening now is going to further influence every decision we make as healthcare providers in the future. And because of what's happening now, there will be significant downstream effects. What we thought was going to happen a year ago is definitely not going to happen. So we have to adjust for an outpatient future and a very changed future. And so, like Mark says, buckle up.
Thank you guys very much for serving on this panel with me. It's always great talking to you. Hope to see you soon. Richard?
Great, and thank you all three of you for sharing your thoughts, opinions, and insights here. I think you're very right. I think we're at the crossroads of some major change in healthcare, and it's going to be difficult to go back. So I look forward to the future.